So head, neck, and spine is a little bit, it's a little different. And my encouragement here is to pay attention to how things are presented, because I'm not going to, there's a limit to how deep I will get into some of this. So if in doubt, ask questions. Especially when you start studying, send emails. You won't really go this deep. Specifically, some people in this class more than others. There's a limit to the abuse that I will put when it comes to this, seeing as how we're covering this in the course of 2 weeks. All right. You all figured out yet? Yeah, that's cool. Decent. Ready for it? All right. So, 33 vertebrae. We break them down into 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, 4 coccyx, and the sacral and the coccyx are fused together. So make those individual bones, the sacral bone, the coccygeal bone. I don't believe they're color-coded that way in the real body, though. They at least more, but again, I probably have the 3% there. Absolutely. Mental note, identifying the 5 major components of a vertebra is probably something you will see again. Hint, hint, learn this. Okay, so what we have the central body, the main body here, and then we have the irregular part that kind of sticks out. What is the role of the central body?
Axial loading.
Axial loading. It's the primary base of support for everything we have. What sits above and below each of those vertebral bodies? A disc. Some kind of, you've heard about people rupturing discs and so forth. So your disc sits above and below. So I would say the disc there is going to be more of our shock absorption, but this is the primary point of transferring the load of your body through, of your upper body through to the bottom half, or the bottom half transferring that resistance up. So then why do we have all these crazy irregular components up here?
Attachment.
Attachments? Certainly.
Attachment set.
For muscles and for ligaments. So there's a whole lot going on that kind of pieces the rest of this together. So main components, the pedicle is this little junction piece right here to the body, between the body and the transverse process here. So this one right here. The lamina is going to be the junction between the transverse process and the spinous process. And then they're difficult to see in this image here. But we have a superior articular process, and on the bottom we have an inferior articular process. So this will articulate with the inferior process of the vertebra immediately above it. So we end up having 6 articulation points for each vertebra above and below. 1, 2, 3, 4, 5, yeah. So 3 points with the one above, 3 points with the one below. The vertebral, the body of the vertebra, and then each of the superior articular processes is going to be with the one above, and then the body and each of the inferior articular processes with the one below. So it's 6 points that these things are all anchored together.
That's lumbar, right?
Huh?
Thoracic and lumbar.
That's probably thoracic, low thoracic. Why?
It looks thoracic because
Why is it? What? Tell me what you're looking for when you see that. When you
body
see that.
I think body be
and
bigger than lumbar.
Okay, so
Transfer process.
the spinous process.
so if we have, if you look at our skeleton up here, you can kind of get a picture of him. We have very pronounced spinous processes on our cervical spine. We have very small lumbar vertebral bodies. There's not as much mass up here for this to support. You get down to the base, and we have massive vertebral bodies sitting down here. So there's a difference if you take C5, if you take thoracic number 7 or 8, mid-thoracic, or you take lumbar, that's 3 or 4. You're going to have very distinct components that are different. The spinous processes in the lumbar spine are usually shorter, stockier. The transverse processes tend to stick out a little bit farther. Thoracic spine, they angle down more because that kind of limits, again, how much you can bend backwards. It kind of stabilizes the thoracic region. You can get a bit more range of motion. The cervical spine, those stick out more directly, so you've got a little bit more extension in the neck. And the lumbar spine, there's quite a bit of space between them, so you have the most range of, you have a lot of range of motion there as well. So each of them has a different function, even though they all have the same basic structures. They just are different size, different shapes, different stresses. So the vertebral bodies, a trabecular bone, makes up the inner strut system to reinforce primary forces. So, much like the rest of our bone, we have a cortical covering, which is a dense, strong bone on the outside, and a soft, creamy feeling on the inside. We have the trabecular bone on the inside, which is more of a spider's framework that kind of helps strut on the inside to help those lateral forces. So, vertical orientation to resist compressive forces, longitudinal orientation to resist shear forces. The trabecular bone on the inside. So there's an area of weakness in the anterior vertebral body that can lead to a collapse if the pressures are wrong. We can end up getting compression fractures. If you have somebody fall from a height and land, there's a good chance that they're going to have a compression fracture, and that compression fracture is going to be in the anterior component. So, vertebral arch, the rest of this happiness back here. So, 3 non-articular processes, 2 transverse, 1 spinous. The transverse stick out to the side, the spinous sticks out from the back. Then you have your 4 articulating processes, the 2 superior articulating facets, and the 2 down below. Now, we can also throw in a costal facet for the thoracic region, because each rib will actually have an articulation with the spine as well. And depending upon the region, it may be with 2 ribs, the one above and one below. Left and right lamina connect posteriorly to form the spinous process. The lamina come here and here to kind of reach out to create the spinous process. And there's your size. So the first image we had, the body's bigger than this one. So we're probably looking at a lower thoracic, but we're not quite getting to this point where we have an upper lumbar. So it's a gradient. There's not like this is a thoracic, this is a cervical, this is a lumbar. The body's going to progressively get from here to there, and the spinous processes are going to transition as well throughout time. Next thing you can kind of notice, well, we'll start up here. Cervical. The size of the vertebra is smaller, is only that needs to support the head. Unique first 2 vertebrae to function as base for skull and increased mobility. What is the function of the thoracic cage, the thoracic wall? It protects our organs. So we have a rib cage that comes around. We have angled spinous processes to where we can't have a lot of motion through the thoracic spine. All of that limits mobility in that area because we have a few vital organs in here that don't like to be jostled. You bend too much, you put pressure on your lungs. You bend too much, you put pressure on your heart. Those things tend to get pissed off and not work right when they get irritated. So, another component we can see is, if you see this, the superior articular facet on the cervical here and here, they're oriented horizontal to where they can articulate fairly simply just by stacking things on top of each other. If you look at the thoracic, they're vertical. They rotate vertically, which means that those components lock in place. So you can't have a lot of shift. It can't shift back and forth. So it's preventing everything from extending too far back to any kind of lateral motion within those, because those articular facets are vertically aligned to hold tight. So once again, thoracic vertebra, another way to kind of identify what they are. Now lumbar, there's a lot more mass, so you've got the weight of your head, your shoulders, your upper appendages, along with all the organs that go with it. So over half your body weight is going to be anchored and sitting right on top of this. So there's a lot of force that goes in top of your lumbar spine.